How do I know when somebody joins?
I'll probably say it.
Hi, just going to wait till some more people come on here. Hey, Antoinette. Hi, Linda. Give people a couple more minutes to join in. Let's see how many we get here tonight. But hey, Julie, how you been? Hi, Barb. Stephanie, how are you? What's up, brother? Ed, how are you? Nicole, nice to see you guys. Hi, Julie. Hi, Antoinette and Brian. Hey, Brian. Hi, Lois. Jim. Nice to see you, buddy. And the families. I see you, Ed. Andrea, that's off. I'm going to get things coming on my phone. That's okay. Kathy's on. And hey, Geraldine, how are you? I hope you're doing good. You know, it's been a long time, but you were one of the original ones where we started from the beginning. So, you know, appreciate that. Hey, Rye, how are you? So I'm just going to wait till I hit a few more people here, and then I'm going to start asking, let everybody know what's going on. And a little bit, believe it or not, Jeff Leider's a little bit nervous. But I guess I'll begin. We're getting some of our numbers coming up. You guys can take this video then and post it to you can share it on your wall. Once it's on, go to my wall and share, which we're going to ask everybody to do. Hey, Cindy, one of my favorite customers. How are you? Down here in Florida. Just so everybody knows, one reason to clear the air why we moved to Florida was for a better health for Jason and Justin, specifically for Jason, so he could breathe better and be closer to warmer weather for his blood circulation, as well as Justin. Before I begin, I just want to give everybody an update on Justin. I know we all just went through that tragedy of Justin being paralyzed from the waist down. He's doing phenomenal. He's doing really good. He's about 95%, 98% back, and things are looking great for him. Complete recovery after that. So I'll begin. So when we were fighting for Justin to walk again, we came home to a celebration of, you know, that Justin is going to be back to where he was. And there was a trial that's been in the making. Now, I might say a lot of things that might not be exact. So for anybody that is joining me and trying to hit me with facts, I forgive you in advance. I forgive myself in advance, or I'm sorry. A trial that came out approximately about 10 years ago, for Denali trial that came out for Hunter syndrome. There's been a few other ones that also were out there. And these trials have been getting delayed and canceled and delayed and go back to the drawing board and whatnot. Well, what happened then was there was another trial for gene therapy that was delayed. And then Denali was the next one up at bat. And it was delayed once again by the FDA. And this trial was delayed by the FDA for 6 months. And why is that important? I'll come back to that later on, why that's important, why that trial was delayed. So this trial for Denali is a drug that my boys right now, they're in a failed IT trial. So for all my New Jersey peeps, we come up to New Jersey once a month for IT trial through a company called 𝗧𝗃𝗃𝗃. That trial has failed and is closed, but 𝗧𝗃𝗃𝗃 is being willing, and thank God, they're keeping it open till all the boys have an appropriate trial. But that trial is closed. Nobody can get into it. There's 43 kids in there. So, while we're doing this IT trial, this Denali trial came out, and my boys once a week get this drug called Elaprase. Elaprase goes into their body, but it doesn't affect the brain. The IT trial that they're in, that I go to New Jersey for, that one is for the brain. Well, Denali came out with a drug for over 10 years of research and development and scientific data. And this drug does the body and the brain. The data that they got out of this trial from Denali was astonishing. The boys that were in the trial, some of them were making reversals. They were starting to gain hearing. Their joints and their bones, like something Justin went through, starts to improve. And all these children were doing great. But I was always worried, guy that I am in the rare disease world, I keep asking the MPS Society and the Munzer research team, amongst others, what is the labeling going to be on it? Now, for anybody that doesn't know, labeling is what the FDA would set of who gets it and who don't. Well, this drug was supposed to come out 6 months ago. It got delayed. Well, then the MPS Society, amongst others, rallied a protest down at the FDA in front of the FDA offices in Silver Springs, Maryland, as well as Senator Johnson. I want you to remember that name, Senator Johnson, because we're going to be using him later on. Senator Johnson out of Wisconsin, he initiated a federal investigation of the FDA of why are they constantly delaying trials? Why is everything's so slow in the FDA? Well, with all this publicity going on from senators, as well as a protest that was held by the MPS Society and Project Alive, they went down to FDA in Maryland. They protested outside. They actually even brought a coffin with them, laid roses on the coffin stating, "You're killing our kids." With all this bad publicity the FDA had, there's a gentleman that used to work there's two departments in the FDA, CDER and CBER. He used to work for CBER. His name was Prasad. He was a gentleman that did not believe in gene therapy or anything that was out there for any type of genetics, I believe. Don't quote me on it. So he was always canceling and delaying trials and putting them off because he didn't believe in it. Well, with all the political pressure and them doing the protests in front of the MPS, with MPS Society and FDA in Maryland, they fired him. And when they fired him, they gave him to the end of April to pack your bags and get out because it wasn't the direction the FDA wanted to go. This made big headlines in the rare disease world that this gentleman was on his way out. Everybody was saying, pray to God. My question was, because I always look at it in a different way, was, what kind of say is this gentleman going to have in our trial, Denali, that was delayed? Now it's coming out again. People said I wouldn't worry about it. Things should be okay. The typical yada, yada, yada with a pat on your back and get on your way. Well, unfortunately, there was a leak in the FDA, and this drug was the decision was coming out if it was going to be approved or not on April 5th. There was a leak, and it came out like 3 weeks earlier. The reason I am just coming to you now is because it took me at least a week to catch my breath and stop crying, and figure out what I was going to do. And why I was crying was because when this drug came out, I got a call, and I'm not trying to get emotional, from MPS Society. Her name is 𝗟𝗲 Klein, a wonderful woman. She's the president of the MPS Society, and she's like family to us. She's been with us from day one for over 15 years. And she called me and she said, now I'm working landscaping, as you all know, in Florida, and the machines around me are loud. She says, Jeff, the drug came out, it's FDA approved, and that's all I heard. Well, I started crying with tears of joy that the cloud over me and Dina has been lifted, and there was something out there for my boys that potentially will be a reversal for some of their problems that they have, and the cloud is lifted, and we can finally live after 15 years of fighting, from spinal meningitis to laminectomies and Jason's trachea, which we all remember, and the fight that we've been putting up with me getting them into the IT trial. I thought it was over, and I started crying in front of a couple of my workers, and then the next words I think I'll never forget is, she said, Jeff, I have to tell you, you didn't hear me, Jeff, but this drug is for pediatric only. And I said, Terry, what do you mean pediatric? I go, does that mean they get it? And she says, Jeff, unfortunately not. And I'll probably never forget those words when she said that. But I couldn't even finish the last house. I told my guys I'm going home because at that point I didn't know what to do. The FDA put on there a big age cap. the age cap was for, and that's going to be important going forward. The age cap was for 16 and 347 days. I'm sure my wife is yelling at me right now because I got the days wrong, but it doesn't matter. It was around that time. So anybody like 16 and 3/4 will say. Because of that delay of 6 months, Justin missed it by 29 days. So Justin didn't get in because of 29 days of missing this trial. Jason was still on the outside looking in. Now, some of the facts are that it's just not Jason and Justin. There's over 30% of the Hunter syndrome world or the MPS community that didn't come across the finish line. The IT trial that Jason and Justin are in right now are, I got to take a drink 1 sec. I'm sorry. The trial that Jason and Justin are in that we come to New Jersey for is, Jen, I'll answer questions at the end here. Oh, there it is. Dina says it's 16 and 364 days. So what I was saying was that the IT trial that Jason and Justin are in now, there was 43 kids left in that trial. 11 of them were not sent over to the new Denali trial with the age cap. That left 11 of them on the outside looking in. And unfortunately, I have 2 of them. So that means there's 9 precious little boys throughout the United States that couldn't get over, plus the other 30% around that have not come across the finish line. It was really difficult for me. I came home and I quit work around 1 o'clock, and I came home and I'll tell you everything, and you know I've always told you everything about what we do with our money and where do we do with the boys and everything that goes on. And I post silly videos from, the hospital when Justin was sick and learning how to walk again. The first thing I had to go through was picking up my daughter. And I picked up Jordan in the car from the bus stop, and she got in with her goofy self and started poking me stuff. And I tried to fool around with her. We pulled over to the side of the road, and I said, Jordan, I have to tell you something. And when I told her the information that was presented to me, she started to hyperventilate and started to cry. She started saying certain things to me, which I knew were reality that I don't want to say on here because I'm sure Justin will be watching. And she started to hyperventilate, crying, and saying about her brothers. And she wanted us to stay a family of 5. And then it was really difficult from our community pool back to our house. And I had this conversation with her. I held her in my arms tight like a dad would. And I tried to explain to her, Jordan, your dad, give me a couple of days and I'm going to fight. But I'm pretty much done with the fighting. I'm tired. I've been fighting for over 15 years with my wife, Dina. And I thought I was finished thinking they were going to get in. Well, I was able to calm Jordan down. And I turned around and here it is at 2 o'clock. And I don't want to call Dina because she's at work and that's not an appropriate spot. I waited till she got home. She pulled in the driveway. I went outside and met her. And I sat her on her bench and I held her knee. I remember putting my hand on her knee. And I said, Dina, Denali came out and it's not for them. She sat there in silence for a few minutes and then started to cry. And she said to me, when is that cloud going to be lifted off of us? And I cried and I looked in her eyes and I said to Dina, I said, today is not our day. And we just came home from fighting for Justin's life. 2 years ago, we fought for Jason's life with trachea surgery. And here we are again in another fight of our lives just for Jason and Justin, along with the other 30% of children plus the 9 that are in the IT trial. And I speak to all the MPS families out there, just not for my boys, that I understand how you feel and it's not right. And I don't feel that anybody should be playing God with our children and dictate who should get the meds and who not should get it. Now, I'll tell you some facts here. We had some meetings with the FDA, not me particular, but other people. And the things that I'm getting from different people is, why would the FDA not approve this? And one of the answers I got from a great mom, I'm just going to say her first name, Kim. She's a fierce fighter in the MPS world. She's real close to me. And she said to me, Jeff, I texted her last night again, and I bothered this woman late. She's like, why? I said, why did the FDA do this? And she says it was pure randomness. And I said, why is that? And she's like, they just picked a number, she felt. I feel that I also heard that it was financial, that the FDA decided, well, it's going to cost the insurance companies too much to take care of the older kids, or the young adults, I should say. The FDA, and I still work for the FDA. Yeah, I will, Elle, about the Duchenne when I was there for Sarepta. I work for the FDA still. I'm a patient rep for pediatrics. And, you know, the things that they were saying is we're there because of financials, that it'd be too expensive, maybe for Medicare, for private insurance, for the older kids or the young adults. Well, as long as I've known, the FDA is here for three things: to prove a drug is safety, efficiency, and effective. If these pharmaceuticals meet those endpoints or those goals, majority of times these drugs get FDA approved. Well, in this case, they did not have a reason not to prove it, because the numbers or the science for the Denali trial is way over the top excellent. So the junk that would build up in their brain, we'll say in our 95% of it gets removed from this new drug in all ages. There is no scientific data or science that would tell us that any older kid or young adult would have any adverse reactions from this trial. But they decided they're going to set a date, a timeline, or a day, or an age, I'm sorry. FDA started out at the age of 10. They said, we're going to give it from 10 and down. And NPS Society and Terry Klein, who's the president, who I mentioned earlier, said, oh, hell no. She wanted 25, would have gotten 99.9% of the children across the finish line. Well, then they came back with an age, well, then Terry says 21. And they were going back and forth with NPS Society and Denali and FDA. FDA says, well, we're going to give you 16 3/4 age. And that wasn't good enough for us. And not for us, for the NPS world. But that's what they set it at. And that's what the label was set at. So here we are on the outside looking in at a drug that potentially, which we know, because if you say a drug, okay, like if I said, this happened to me once before. I said the IT trial that's failed and not getting, and my children are getting, I once said that's a life-saving drug. And I got called from one of my bosses at the FDA. She says, Jeff, you can't call that a life-saving drug, because it wasn't proven by the FDA that it's life-saving. Well, this drug is FDA approved for 16 3/4 under. So I can say it's life savings, because that's what I've been taught. It is a life-saving drug. It's going to help these children. There is reversal. So what are the reversals in the Denali trial? And the name of the drug is 𝗂𝗲𝗄, which Dina is going to put it up for me there on the screen. I still don't know how to pronounce it. Forgive me. But this drug is making hearing loss go away. It's removing 95% of, we're going to say, the junk in their brains. They would be getting brain meds once a week along with body meds once a week, instead of getting brain meds once a month, what my children are getting now. They are improving in their joints. They are improving, some of them with speech, and they're making turns. So the question that I lay in bed at night, thinking every single night, is why wouldn't the FDA or somebody at that department make this drug approved for every child? So everybody has a chance. Everybody gets a chance at this. Why would you take 30% of American families and ruin them and maybe potentially take their children away? Or the 11 families that are in the IT trial. Why would you do that and play God with our children? There's no reason for it. The reason they came out with was pure randomness by people that told me that, as well as financial. Now, my boys get it, what is considered an ERT. There it is. Thank you, Dean. It's 𝗂𝗲𝗄𝗂𝗂𝗂, something like that. It's so new, I don't even know how to pronounce it yet. But my children get ERT, which a nurse comes to our home once a week. And this is very important as the facts build. ERT is an enzyme replacement therapy for Elaprase, which they get now, that doesn't do anything for their brain. Since the FDA has began, They have never put an age cap on older children for an ERT. It's never has happened. They put an age cap on younger children for 𝗟𝗶𝗲𝗍 at the age of 2 and up because they didn't think the children were big enough, their body weight or whatever it may be, to control the drug. But they have never, ever put an ERT, enzyme replacement therapy, on an age cap on the older age. This was the first one. The reason, and this is my sole opinion, again, it's my opinion with information that I have gathered, with Congress, Senator Johnson, which we're going to get to, doing an investigation on the FDA, federal investigation, and MPS Society and Project Alive, amongst others, going to the FDA, bringing a coffin and saying, you're killing our children. And all of the stuff going on, I believe it's pure political. I believe it was a big FU from the FDA, Federal Drug Administration. I believe that they said, we are going to approve your drug, but we're going to say FU because we're not going to give it to anybody. Now, these are my opinions. These are my feelings. Okay. But from what I have gathered from talking to significant people, I believe it was a big FU from the FDA, and because it was pure politics. Okay. It was pure politics, and that's all it was. It had nothing else to do with it, because when the data for this trial, which I can share that link to anybody going forward in the next few days, shows you how great the data is and how great this trial is doing and showing how good the kids are. There is no reason that children from the age, let's say 17 to 25, don't have a chance to survive. There is nobody out there that should be able to dictate on who lives and who you know what, because I know Justin will be watching. No one should be. That should be up to God and God himself. So the reason I brought everybody together here tonight is because we're strength in numbers. Years ago, no, Donna, Big Pharma just passed her pockets. No, I'm going to stop that right there. Denali trial, Denali Pharmaceutical, has been busting their ass. And I know people, and I'll mention first names only, Jeanette, Kim, Terry, I could go on and on, that sit on Denali board. And they are MPS parents. And Denali, and I know the CEO, the guy is a wonderful guy. He is racking his brain some way, somehow, any way he can, by law, in order to get the rest of these children across the finish line. Denali trial is not, Denali Pharmaceutical has their best interest in all the children. They celebrate it, but they also cried at the same time. I know that firsthand. As well as IT trial, which is ran by Takeda, that my boys have been getting for the last maybe 10 years, has been free. That trial has failed. Takeda's answer is, we will never give up on our MPS boys until something else comes out. Well, when something came out FDA approved, and like I told you, there was 11 left in the IT trial, Takeda said, we will not stop this drug for those 11 boys until they can get into something. And they've been on that Takeda trial for years after it's been denied. And Takeda has been paying for our airfare to get to New Jersey, our spending money, our rental car, and our hotel, even though we don't use it because we stay by our mom's houses. So I got to stop that there. So the trial, the pharmaceutical companies are doing it great. This is purely on the feet of the FDA. Now, what we're going to do is we're strengthening numbers here. And what I mean by that is, years ago, some of you might even remember that Jason and Justin were on the outside looking into the IT trial. They couldn't get in. Long story short, me, Dr. Munzer, as well as a woman named by Melissa, I went and I led the crusade with all your help. And we went to the FDA, and I see you too. And we were able to create an extension of a trial for me to not only get my 2 boys in, but another 12 kids. So I was able to get 14 kids in on the extension that I did. Well, that was because of what you guys did, of writing letters and sending phone calls to Bill Pascrell's office, if anybody remembers. It was great. And we got it done. And I can honestly say not only me or my wife Dina, but all of you had a hand in saving Jason and Justin's lives and 14 other children years ago. Remember you remember that, Ed? It was years ago that we did that. And we saved them. Well, here we are again at this point and crossroads of where do we go from here? So Dina is not on because Dina is she's downstairs actively going to put the link up soon. Okay, now I know this is a really fierce political world we live in, but when we're talking about loved ones and life and death and children and young adults, there is no politics in my world. And what we're going to ask everybody to do is to come together as one and help us. I'm sorry. What we're going to do is, first and foremost, I mentioned Senator Johnson's name, and Senator Johnson is out of Wisconsin. The link will be provided to you from Dina, which I'll be tagged on it, and she'll tag everybody in our family so you can get it off of there. Senator Johnson has a link on there, and it's self-explanatory. And we're going to want you to go on Senator Johnson's page, and you could actually send him an email, and you're going to click on where it says little arrow. It says you're going to scroll down and click on health. You got to put your email address in and phone number and everything. And then it's going to say that we're going to ask, and it's all self-explanatory on here, but I'll elaborate, is that we want the age cap to be removed so all children can get a chance to survive, as well as how is important to you of Jason and Justin and how they make sure you mention their last name leader and how they have impacted your life or connected you or made you a better person today of watching what they have gone through. That's the first thing we're going to do with Senator Johnson. The next thing we're going to do in that link provided is an email and a link to take you to our vice president and our president. I'm a true believer in that, regardless of what you may think of our politics, you're a Democrat or Republican, it don't matter. It's a matter about those smiles up there. And it don't matter what you like or whose policies you like. It's about that right there. And the other 30% that couldn't make it. And what we're going to ask you to do is to continue multiple times, as much as you can, to continue to write letters through these links to President Donald Trump and our vice president, as well as Senator Johnson out of Wisconsin, and just keep pushing it. Because, and it's all self-explanatory, the links will be up, and we have a team of original Let Them Be Little Foundation people that are willing to help me. But I guess I just have to say that I'm a desperate dad. And, you know, that means a lot to me. And I just can't fathom that somebody could be out there in America dictate of who gets meds and who don't, when this drug has been proven safe, it's been proven effective and efficient by the FDA, and then they go ahead and put an age cap on it. And that is not sitting well with me. And regardless of how you may feel about politics, I just ask you to, you know, share this with any of your friends once you get the links. And I'm a true believer in that, you know, if we did it once before with Congressman Bill Pascrell, and we could get to the White House. I'm a big believer in we could get to the White House. And it's just not for the smiles behind me. It's for the other 30% of the parents that don't have the luxury of having over 5,000 friends. I have over 5,000 followers. And I'm asking everybody if they could please help us. And what we're asking again is to remove the cap, age cap, so all children can get a chance to continue to smile like Jason and Justin And hopefully someday Jordan's not standing there alone. And we ask you to please help us in God's name. Amen. If anybody has any questions, I'm here. I can see that. If anybody has any questions, I'm reading comments right now. I can answer a few questions. Thank you, Tracy. Thanks, Aaron. Does anybody have any questions that they want to say? If you, hi, Dina. Dina, hi, how are you? Dina, you're a big supporter of mine, and we go back a long way. Dina, if you could reach out to me, and maybe we could get Andy Kim on this, that would be great. I would appreciate that. Yeah, new agencies and television, we're going to be working potentially with Fox. When I moved to Florida, I kind of lost all my things, all my connections to ABC and CNN and whatnot. So what can we do in New Jersey? What we can do in New Jersey is Congressman 𝗟𝗶𝗳𝗲𝗏 is a very, very good friend of mine. When I lived there, she took over for Bill Pascrell. Thanks, Ryan. I appreciate you, brother. And she took over for Bill Pascrell, and she's a congressman now. And she has a strong connection to Jason and Justin, because if you remember, back in the day, 𝗟𝗶𝗳𝗏𝗏, Jim Monaco, and myself went to Trenton, and we started a law in the state of New Jersey called the Let Them Be Little Law, that every boy that is born now in the state of New Jersey is being screened for Hunter syndrome at birth in order to knock away the adverse problems of Hunter syndrome. So 𝗟𝗟𝗏𝗏, if you want to reach out to her office, we can provide that too. But she's on it. Her chief of staff is working behind the scenes with me, with Nellie already. But if you want to reach out to her at her office in Patterson or in DC and just thank her, say thank you so much for just helping Jason and Justin. And she needs to know that, you guys in New Jersey are there and want to thank her for everything that she's doing and what her staff is doing already. Can we write letters to her and push to see if we can push? Yeah, you can write letters to her. Dina, there is left on the new. Okay. Yeah, we could do that. Send letters to her, but Dina's going to be putting up the link. She's going to, you can get the link off of her, and, help us out. Your thing went off, George. Rosemary says, sad part is that it's not many people who need this medication. It's like saying everyone over 50 can't have chemo. It just doesn't make sense. Yeah, that's a good point, because if, the children, if you look at 30%, it's about 200 kids. Approximately, like I said, reach out to Dr. Oz. I'm willing to talk to anybody. That would be great. So, Tracy, so is there no data to prove is it effective for people over age of 16? Doesn't make sense. No, all the data is there. It's pure science. It works well, for everybody. Tracy, you were my right-hand woman, I should say, for the foundation. You actually made me look good. And to be honest with you, you've been there. And, this is I think a political thing with the FDA, as well as they said financial thing with the FDA, which they're not there for finances. They're there to prove medicine that's safe and effective. And this drug was proven to be safe and effective. I've talked to Dr. Munzer and other real top people in the MPS world, and they said the data is off the charts. Can you include a sample of the facts in the letters? Yes, it's all in the letters, Jess. Once you get the links, Dina has provided in the links, the facts that have to be, and we have templates that would be added to the letters to President Trump and Vice President Vance. And then we ask that you ask to get the cap removed, and how Jason and Justin are important to you and how they have changed your life. FDA needs to, I didn't get that, what you said there, Elle. Elle is a big rare disease person. What did you say, Elle? I missed it there. Let me see if I can find it here. FDA needs to leave financial concern. Yeah, you're absolutely right, Al. They do. But they did it. They, this was completely, financial, and randomness. I text Kim, and I think, you know who I'm talking about, last night. And she said, I said, what was their main thing for an HCAP? And she said, that, it was pure randomness, that, you know, that was the reason that we had it. So I'm going to ask you guys, you know, the best that I can, I'm just going to rotate this a little bit, is, you know, do whatever you please can. Please, please help. Go to our pages, to our links, and I'll show you a picture here. Go to our links, and, you know, please share with your friends. Try newscasters. I have people that are working, trying to get Fox. Again, I'm a desperate father. And I know Dina is not the type to come on here and fight publicly. That's not in her. But she's doing a lot of work behind the scenes. And all I can say is, please, I'm desperate. I need your help. And I'm hoping that someday that we could be this family again, laughing and be happy and lift this cloud off of us. I thank you for everything, for everybody that joined us. Please share, and please, please help us get our boys across the finish line so Jordan is not alone. Thank you. God bless you guys. And God bless Jason and Justin and all the children that did not get across the finish line. Thank you, and have a good night.